Hi everyone, welcome back. So today I'm going to be talking to you about how massage can be used to help those of you suffering with some kind of respiratory condition or lung disease. It's a common belief, that massage is great for stress and to ease tight muscles, but actually it can also be, highly beneficial in respiratory problems, whether this is due to a medical condition, allergies, pregnancy, or, even as part of post-surgical rehabilitation. Now, I'm going to focus in this video on asthma, COPD, cystic fibrosis, and bronchiectasis. But, massage will help, numerous other respiratory issues in addition to these. So when those accessory respiratory muscles at the front and the back of the body are tightened, what happens is that normal breathing becomes restricted. But by using specific massage techniques, these muscles can be lengthened and relaxed, which then improves breathing capacity and also function of those muscles. Now, restricted breathing is a common sign of stress, and shallow, short breaths will replace that natural breathing pace. And this is due to the muscles around the rib cage and the abdomen tightening and therefore constricting air. And when this happens, it's almost impossible to reach a relaxed state. And so this is when you can get issues such as panic attacks, because you can't relax those muscles enough to kind of get the air in. But massage can help to retrain the body to relax and consequently improve breathing by relaxing these muscles, and also, by helping to improve, that client's awareness of their stress levels, and hopefully then that they'll sort of start to deal with those, stress, whatever the event is that's causing it, they'll start to deal with it hopefully a little, better. So examples of respiratory issues that can be eased with massage are allergies, sinus problems, asthma, where the airways are persistently inflamed and may spasm, which then causes wheezing and shortness of breath. Bronchitis, which is a sudden infection of the airways, usually caused by a virus, sometimes comes with a chronic productive cough. As happens with chronic bronchitis, which is actually a form of COPD, which is chronic obstructive pulmonary disease. It can also help with bronchiectasis, which is a long-term condition where the airways become abnormally widened, and this leads to a build-up of excessive mucus, which then makes the lungs much more vulnerable to infection. Pneumonia, cystic fibrosis, which we're going to talk about, is a genetic condition which causes poor clearance of the lungs and accumulation of mucus from the bronchi, and this again results in repeated lung infections. Chronic obstructive pulmonary disease, or COPD, or sometimes referred to as COAD, which the A stands for airways. So these are lung conditions which are defined by an inability to exhale normally, which then causes difficulty in breathing, because you don't get all that CO2 out, and therefore the sort of oxygen saturation levels drop. Emphysema, which is lung damage, basically allows air to be trapped in the lungs, which then results in difficulty in exhaling. Emphysema, again, is a form of COPD. And also lung cancer, can be helped through massage. So how exactly does massage help to promote deeper breathing and also easier breathing? Well, it can help lengthen and relax those accessory respiratory muscles, which will then improve breathing capacity and function of those muscles. It can help improve posture, which leads to opening up of that chest area, structural alignment, and also rib cage expansion, which is needed, for optimal lung function and deep breathing. Massage also will impact on the parasympathetic nervous system, which will slow and regulate the breathing rate and encourage deep breathing, that of course we all should be doing. Specific techniques such as the tapotement and vibration techniques. So the tapotement is things like your hacking, or where you sort of use your fists, or the cupping movements, and the vibration is like a shaking type technique. When performed on the back, these type of techniques can really help loosen mucus in the lungs and increase airway clearance, which means better lung function. So, there's a few ways that massage can really help. So once you have a massage or a course of massage and you find that you're breathing better, what are the benefits of this improved, deeper breathing? Well, controlled breathing aids relaxation. Any of you out there who have done, meditation to, try and relax, it involves deep breathing. Improved breathing will also kind of help retrain the mind to relax before stress becomes a chronic issue that then damages, the body in some way. It will improve breathing will also help increase the energy levels, because you're getting more oxygen into the system, and this in turn will also aid a speedy recovery from any kind of illness or injury. And of course, improved breathing during pregnancy will help to really just keep the airways open, which of course during the labour, and also during pregnancy itself, when you're carrying around this extra weight, will really help. Muscles are compensating for the changes that take place in pregnancy. Internal organs are under pressure from that, extra weight. So help with breathing techniques and reducing anxiety in labour is really going to, benefit both mum and baby. Okay, so I'm now going to talk about some specific respiratory diseases and how massage can help with those specific issues. So first up, we are going to talk about asthma. So massage can help asthmatics by basically relaxing those muscles, opening up the lungs, and encouraging good breathing technique. Stress and anxiety are actually often considered to be an allergen, and certainly in asthma, this is true, and it can cause, spasms and constrictions of the airways, which then obviously is where you get your difficulty breathing. But massage will actually, maneuver the muscles to help relieve the stress and anxiety and just help those respiratory muscles again, obviously, function more efficiently. Massage for asthma not only helps to treat the symptoms, but also improves circulatory, muscular, and the nervous systems, which will all, sort of help control the, sort of future, not only the symptoms, but, future attacks. And massage can also help to remove the substances that contribute to asthma attacks. So, for example, for some people, cold, dry air can cause bronchospasms and airway constriction. So, massage will help to decrease the symptoms by providing warmth through friction, while easing the muscle tension and decreasing the production of mucus in the lungs, and therefore improve breathing. A massage in warm, temperate air will not only relax the body's response to these substances, but also offer mental relaxation, which again, reducing stress levels is hugely beneficial in asthmatics. Now, it's important to say massage does not replace the need for inhalers, but it could reduce their usage. And, if you're having a course of massage treatments for your asthma, then certainly taking peak flow measurements can be used to assess, the effectiveness of the treatments and how well they're working for you. Okay, so the next one that we're going to talk about is COPD. Now, this is a little bit more complex because the type of massage treatment will vary according to the stage of COPD that someone is in. Massages will certainly help to relieve stress and reduce pain, but it's really important to be aware of which type of massage will suit you best. And also, this is where sort of seeing someone who is experienced in dealing with this kind of issue is important to ensure that you get the most out of your treatment. So, if you're stage 1 COPD, this is where you may have occasional bouts of shortness of breath and coughing. So, for this stage, you can choose from many different types of massage. You could start with a Swedish massage, to kind of get sort of your stress levels reduced, and then move on to maybe a Thai massage or a deep tissue, which could include some myofascial release therapy to work on that connective tissue between those, respiratory muscles, which can get tight and restrict movement, particularly around that rib cage. Stage 2 COPD. So this is where you have breathing difficulties upon exertion. Now, in this case, all types of massage can be selected since there is no exertion involved in having a massage. However, you may find that Thai massage may be problematic just because you will be actively moving into positions that you may not be used to, which could potentially cause exertion and breathing difficulties. But any other type, there's really no issue. Stage 3 COPD. So this is where it's becoming more difficult to do daily activities. And in these cases, the only massage, that should be, used is something where the massage therapist does everything for you. So it could be Swedish, deep tissue, hot stone, reflexology, lymphatic drainage, but certainly not a Thai massage. You literally want something where you're going to lay there and the therapist will do the work. Okay, and so then finally in stage 4 COPD, which is the worst level, this is where you will have severe reduction in airflow and difficulty in moving. Now, in these cases, massage must not require any active participation. If you can't lie face down, the massage can be done in a seated position. And aromatherapy massage, actually using essential oils, things maybe like peppermint, eucalyptus, wintergreen. These are oils that can help to clear, the waste from the lungs and the sinuses. So that may also be beneficial. Now, things to remember about massage for COPD. The benefits of massage can be felt immediately, but the benefits will increase with regular massages. So ideally, make weekly appointments or, a course for 10 weeks minimum. Then evaluate your progress and how it's working for you. Ensure that you are fully hydrated when you get your massage, and ensure the same for 2 full days after your massage in order to assist your body just with detoxification. So that is the COPD. Okay, so we're now going to talk about how massage can help those with cystic fibrosis. First, just explain a little bit for any of you who don't really know much about CF. It affects approximately 30,000 children and adults, and there are approximately 1,000 new cases diagnosed every year. It certainly can affect life expectancy. As of 2017, this has increased, however, to the mid-40s. It used to be a fair bit younger. It's a genetic condition which affects the breathing and the digestion due to thicker than normal mucus, which forms in both the lungs and also the pancreas. Usually, CF patients will be given oxygen to help with the symptoms, but massage can really help improve the breathing, when it's focused on those respiratory muscles, potentially not eliminating the need for oxygen therapy, but certainly it can help to reduce the need for oxygen therapy. Being unable to breathe properly for long periods of time, it has huge physical and mental implications. So by easing the breathing difficulties, massage can really help reduce anxiety, improve general mood, and, help coping strategies and promote just a better quality of life and, allow potentially clients to achieve their goals. Fluid formation prevents the body from utilising chloride, which is a component of salt, in cellular fluid osmosis. And so this causes the fluid to become very thick, sticky, and this thick, sticky secretion then blocks the airways, hence means reduced air ventilation, and therefore the person has difficulty breathing. It can increase infections, inflammation, and also other respiratory, complications. So, where possible, with CF patients, cardiovascular exercise is important and should work alongside massage in order to, improve lung capacity. Research shows significant reduction in pain and improved breathing, both in the acute and clinically stable clients. Myofascial release on the muscles around the rib cage can really be beneficial with breathing difficulties. So we're talking rectus abdominis, the oblique muscles, scalenes, the intercostals, which are those ones between the ribs, and the serratus, again, sort of between the ribs, the quadratus lumborum on the back, lower back, and those erector spinae muscles that run either side of the spine. So those are the sort of muscles that will be targeted. Vigorous styles of massage, such as sports massage, and those vibration and tapement movements that we talked about earlier, can really encourage movement of phlegm and fluid and all those sort of thick, sticky secretions that are blocking up the lungs. So, common signs and symptoms of CF are salt-laden skin, a persistent and productive cough, shortness of breath, sometimes wheezing breath, frequent bouts of pneumonia, bronchitis, and other sort of similar lung conditions, possibly bowel problems, if it affects you, in a digestive capacity, and also poor weight gain efforts. And again, this is really due to the digestive system and functioning being inhibited. So in terms of treating a CF patient with massage, as a therapist, you have to ensure, due to the high risk of infection, you have to ensure a thoroughly clean, environment. And also just, it's common sense, but, your hands, ensure that they are thoroughly washed, and I'd even say using hand gel and things before treating a client with CF. Really just to protect them with that risk of infection. So yeah, so that's pretty much it for cystic fibrosis. And then the final problem that we're going to talk about is bronchiectasis, which some of you may not have heard of. But this is where the airways of the lungs become abnormally widened, which then leads to a build-up of excess mucus that again makes those lungs more vulnerable to infection. So again, massage in these cases will help just clear the sputum from the lungs, reduce number of infections, and hopefully reduce your cough as well. Sports massage, and again, those techniques such as the vibrations and the tapotement can really help, dislodge and clear that sputum that's built up and encourage deeper breathing through relaxation. So a lot of these issues, the way that massage helps, is quite similar to a lot of these conditions. It's not a replacement for any medication or oxygen therapy. But, as I've said, it can really help manage the symptoms, and, it may mean that you are able to at least reduce the need for oxygen or medication. But certainly, I would say that any massage treatment, as I say, you want to see an experienced and qualified therapist, but also I would say that your therapist would just kind of liaise with maybe the physiotherapist or whatever specialist, is dealing with your condition, particularly in cases of cystic fibrosis. So yeah, that's really massage for lung conditions. In terms of lung cancer, you may also just want to take a look at my video on massage for cancer patients, which is already up. But yeah, feel free to comment down below or ask me anything through my Facebook or Instagram. And by all means, subscribe to my channel and you'll be notified when more videos come out. But yeah, for now, that is all from me. So take care, and I will see you next time. Bye.